tell you that I've done this presentation in PNW conference. I've revised it for Alaska, but we did 3 hours. So I'm going to get started. I'm Bruce Galvin. I'm the conference benefits officer up here, and I think I've been here for a few years. I bring kind of my knowledge from being around the church a long time. And what we're gonna do today, and make sure we're small enough for it, if you have any questions, let me know. And for some of you, we're gonna talk about our retirement system, and it might not have any relevance to you at all, especially if you're a layperson. But it'll give you kind of an idea of the strange retirement system we have as a Methodist.
We gotta pay for it.
And then we're going to talk a little bit about, under the new retirement system, how important, it's going to really be important that people contribute to their own retirement. And then lastly, if you hang in there, we're going to talk about healthcare reform. And it's interesting, I didn't change the state exchange, and you would know from Alaska that you don't have an exchange, you have a federal exchange. That probably is a slide I didn't change. I did down in Washington, because Washington will have their own state exchange. So that's the plan for the morning. And if you have any questions you want to ask, it's not relevant at all, that's fine too. I can try to take it on. Does everybody have a handout? Okay, very good. And one of the decisions that will be coming to annual conference this year, and the reason that I'm providing this background about our retirement program is we have a new retirement program starting next year for all clergy. And one of the decisions that has to be made is what do we do for part-timers? And so to make that decision, you really need to know where we came from. And it's really job security for me, because this will be the 4th retirement system. And I've actually been around, I'm actually pre-82. I've been around since, I was started when all this stuff happened. So I'm kind of lived through all of it. So we currently have 3 retirement programs. Pre-82, pretty simple. I think you get that if service for prior to 1982. It actually was called the Ministerial Reserve Pension Plan. I won't ask you that at the end of the day, but it's called MRPF was the name of it. And for churches and conferences that back prior to 1982 really didn't have a pension plan in that sense. We gave people credit for the time that they served, and we gave them an amount of money when they retired. But we never funded it. Slight problem. And finally, it was becoming a huge deal that we had all this unfunded liability that had been built up, that we had to figure out a way to fund that program. So, General Conference in 1980 decided, the liability is too great, we need to change plans. We need to get out of a defined benefit plan. And you're going to hear the term defined benefit, defined contribution, and it's kind of interesting how the church dealt with this, because we had this huge liability, and for those of you that aren't familiar about a defined benefit, it's exactly what it's supposed to say. It's a defined benefit. Normally, it would be so many years of service times a certain rate. You define what that benefit is. Or, in some cases, it could be your last few years of compensation. It would be a percentage of that. That's not how the church works. In our case, it works really well, because the pre-82 plan isn't a defined benefit plan in the sense that you get a past service rate. And one of the things that you're going to do later today, or I assume tomorrow, you're going to approve a past service rate for pastors that served prior to 1982. Well, that would be all simple and fine if that's how it worked for everybody, but that's not how it works. Because at the same time, people got money in their accounts. And when you get money in your account, that becomes what's called the defined contribution plan. And you would know from a 401k, a defined contribution plan just means that money goes into your account and it grows or doesn't grow depending on what the underlying investments do. Well, lo and behold, in 1982, I'm kind of giving you the answer to this, but when did the bull market start? The long bull market in the financial markets. When did that start? You're supposed to say 1982 because I just gave you the answer. The bull market started, money was put in these people's accounts even though we didn't know that's what was happening. I think only the General Board of Pensions knew that this is how it worked. And probably around somewhere in the late 90s, this defined, come on in. This defined contribution account, because that's what it is, it had a value. And in the late 90s, the actuarial value of this account was better than the year's tax rate. And where it's really played out is if somebody, and Craig sitting over here is retired and he can tell you, he has a few years in pre-82, and that's providing...
Not enough!
What do you mean, not enough?
I don't want to be older, though. I'm perfect. I'm perfect. Perfect.
So, the pre-82 plan ends up being a defined benefit plan for many of our older legacy people, but a defined contribution plan for anybody that retired after, well, let's say 1998. And I can tell you, in the Pacific Northwest Annual Conference, right now, and I'm not giving it away about Craig, but anybody that retires, that has retired in the last few years, their benefit under the defined, under the pre-82 plan is about 3.5 times greater than the year's times rate. Yeah, that's pretty amazing. So in PNW, our past service rate, let's just take an example. Our past service rate is a little less than $700. If you work 10 years, easy math would say that it would be 10 times 700, which would be $7,000 a year. What's 3.5 times that?
25,000.
25,000. Okay. That's the defined, that's the pre-82 plan. It's weird, very weird, and what's the problem is it's caused a huge inequity depending on when you came into ministry. Somebody that served their whole career and they retired 20 years ago, they get about half of the pension as somebody that retires now. And that's not what a defined benefit plan is supposed to do, but that's the church's plan. Okay, so what did they do? We had all these huge liabilities that were built up in I know I'm wandering around.
It's okay, you're good.
In the pre-82 plan, and so they changed it to a straight defined contribution plan called the Ministerial Pension Plan in 1982, and each annual conference got to choose what kind of a percentage they wanted to provide and then at what level on what compensation. Most annual conferences pick 12%. You can either pick 11 or 12. And most annual conferences picked on the denominational average compensation. So the interesting part of that is that it didn't matter if you were at the lowest paying church or the highest paying church. If your conference chose the denominational average compensation, you would all get the same amount put in your account, which is equality. It's probably the only place that we have any equality within the church is under the ministerial pension plan. Well, when did the bull market start? 1982. Anybody that served all those years from 1982 to 2006, because that's when the plan went out, they have over $500,000 in that account. What this is saying is, I'm not pointing to Craig. I'm just
raised my
saying,
hand.
anybody, what this is saying is that it just so happened that a defined contribution plan, given what happened in the stock market, actually is a much better plan than the defined benefit plan could ever be. So don't let anybody tell you that necessarily a defined benefit plan is always going to be better than a defined contribution plan. It depends on the underlying stock market. Well, what does the church make you do? What did General Conference say when you retire? How do you get the ministerial pension plan money?
Annuitize.
You got to annuitize it. Guess what? That defined contribution plan just became a defined benefit plan. So we have the same issue as we do pre-82, that there's a huge inequity. It depends on when you retire, how, what the financial markets are doing when you're retired. Now Craig knows this answer.
He's known all the answers so far.
We're sleeping together. we're in the same room.
Yeah,
It's on tape.
Now there are three things.
Well, Craig was here yesterday afternoon, so there's
That's
no
right.
excuse for that.
I got the fence right. We had the fence
It's
up.
going on Facebook.
So there are three things that determine what your annuity is going to be. One is you have total control over that, and that is your age. You can't change your age. You can change it by deferring it to a later date. You'll have less life expectancy. Age just means that they look at some actuarial table and says that if you're 65, you're going to live 20 more years, and we've got to pay your benefit over the rest of your life. So that's pretty easy. The second thing we've talked about is the balance in your account, which is pretty large. Unfortunately, the third factor that determines your annuity is not good, and we're trying to work something out with Craig to see if we can beat the system, is something called an annuity interest rate conversion. When you retire, the money is up here, and the actuaries say that you're going to die over here, and that money declines over its lifetime. So if it was a perfect picture, there would be nothing left when you retire. I mean, when you die. We all know that's not going to happen, but on a large group it happens. So that money then gets converted from wherever, however it's invested here before you retire, it gets converted into bonds. Well, what do we know about interest rates right now? They're at historical lows, and the interest rate right now used for the conversion is a lowly 3.5%. And this is paid for the rest of your life. Now here's an inequity.
It doesn't get recalculated each year?
No, it's what it is. Let me ask you this question. Let's see who knows the answer to this. If you retired in the year 2004, what do you think your interest rate conversion was that year?
6.
04?
Yes.
Probably about 6.
Wrong.
5 to 6.
Oh, the church is very generous. The church gave you 8% interest rate conversion, and it was 8% starting since 1982. But you have to remember, you didn't have this conversion thing till it was later in life. I mean, later in the 90s. So what happens is that wasn't market based. And at 2004, they changed the whole pension plan to be market based, and so the interest rate was changed from 8% to whatever the market is. Now, can you imagine the difference between interest rate conversion of 8% and an interest rate conversion of 3.5%? It's big time. So there's another huge inequity in our system. In fact, they grandfathered many people in, because if you were eligible for retirement in 2004, you were grandfathered in, and under the rules, you only had to have 35 years of service at that point. The perfect time to retire, if you were grandfathered in, would have been the year 2008. So if you know anybody that that retired in 2008, they have the largest pension. That's reality. I mean, that's crazy, but that's our retirement system. So what did they do? General Conference decided this is too expensive. I think we already went through that back in 1980 when they said our old pension plan was too expensive. So they changed it. They finally got it right. They moved to our current system, which actually has two components, defined benefit and defined contribution. And it is a defined benefit. The markets have no impact at all. The interest rates don't have any at all. But they're changing it. Too expensive. So we're going into a new plan. So it's pretty interesting kind of what we've gone through. One of the factors, though, that you need to know, this plan and this plan, they're all one big plan for the whole denomination. So we're all in it together, we're all funded the same, and I don't know if any of you have looked at your pre-conference handbook, but in there I put a funding plan together, and it talks about these two plans, how we're funding them. One thing good about the church, well, I should throw out this caveat. Any time that you have a defined benefit plan, the annual conference has to pay the benefit. What do you think is going to be the likelihood that the conferences are going to be able to fund these benefits if the church is declining or the church goes away? Now, Craig, I already posed that to you earlier this morning.
Well, if the church goes away, it will be totally unfunded.
If the church goes away, I mean, if we
From their
have
flow.
funding, who's going to pay for it? How are we going to do it? Can't tax anybody if we have nobody in the pews. Well,
Hopefully you got enough in the bank.
that's true. See, I was just throwing that out there. The one thing good about the United Methodist Church is fully funded. The MPP plan is overfunded right now. I mean, it depends on what the stock market does. And then the way they set up the current plan, that we had to be fully funded at the end of each year. I mean, we don't know what the stock market is going to do. So if the stock market went down during the year, then we would have to come up with more money. So the thought is that we're fully funded. We're not like state governments and federal governments where the plans are not fully funded. And so we're one step ahead. If the markets return a reasonable return, we would have a retirement plan funded without having anybody in the pews. And that's why you don't see us asking for any money for these programs, because they are funded.
This
But
assumes that you're not funded by Bernie Madoff or something like that.
that's true. We hope not, or some Ponzi scheme.
Fully funded is all relative.
That's true. It's fully funded according to the actuaries. What the actuaries do, they pick a time that they look at all your assets and all your liabilities, and that's when they determine if you're fully funded. And they do that once a year. And right at the moment, well, all we know is the last actuary evaluation was done as of 1/1 of 2011. What do we know about the stock market in 2012, and what do we know about the stock market so far this year? It's up substantially, and so we know that we're way much more overfunded now than we were previously, but we could have a market correction and we could go the other direction. We would know that back in 2009, the actuaries assume that we will make 7% a year on our money, which might be a little aggressive, not aggressive. In 2009, can anybody tell me what how did our investments do that used to fund our retirement plans? Assuming the actuary said that we were gonna make 7%, what do you think happened?
-2.
Lost.
We lost 24%, 25%.
I'm not pessimistic.
So that was not a good year, obviously, at that point in time to bring these two plans fully funded. The denomination had to come up with $100 million. New money. Well, how did we fund that? I mean, how do you come up with $100 million when churches are struggling? And you didn't hear anything about it.
Didn't we?
Well,
have a
trade among
surplus?
conferences, for one thing.
Yeah, but there's something, if you remember your pastoral support worksheet, there was something called the CPP holiday. That's the Comprehensive Protection Plan. The General Board of Pensions was way overfunded. And they basically said we had 3 years that they would give us a holiday that we didn't have to pay them. And so we still collected the money from the local churches, and that then helped pay for that $100 million. In fact, we actually ended up we made money off of that deal. So that was a pretty good deal. But that's not going to happen in the future. The CPP is not so much overfunded. So if we had another 2009 and we lost 25% of our money, we better figure out a way to be able to handle that. And if you've read the funding plan, you'll see what we're trying to do in this conference. We're building reserves.
Did any come out of pre-82 overfunding for that?
No, no. Okay, pre-82, interesting thing. We're not all equal. Back in 1980, General Conference said, you have 40, remember, many conferences hadn't funded anything and they had all of these liabilities. So General Conference gave each annual conference 40 years to fully fund their retirement plan. So 40 years is coming up in 2021, it's not very far away now. And again, when did the bull market start? 1982. So we all know about compound interest, right? If you get your money in early, and the actuaries assume that you are going to make 7% rate of return, and we actually made double digits in the 80s and 90s many, many years, you would know that. We talked about people's account balances and everything. If conferences got their money in early, then they're overfunded now. If conferences did not get their money in early, they're not overfunded, and they're really negatively impacted by what happened in the markets in 2009. Let me give you an example. The Alaska Conference and the Pacific Northwest Conference got their money in early. I don't know how you did it up here because I wasn't here.
Special fund drive.
That's a fund drive. So you got your money in early. And that just meant that when the markets made the huge returns, that you ended up not taking 40 years. You were fully funded within 10 years ago. You were fully funded. So you're actually overfunded now. Let me give you an example of a conference. No, I'm not fast enough on this thing. The North Georgia Conference. They're quite a bit larger than we are. Well, especially here, even PNWs are probably 4 or 5 times bigger. They didn't get their money in. I have no idea what happened. Or they figured, well, we got 40 years, I guess we'll just work on it as time happens. Well, compound interest, they didn't get the money in. And they're probably a little bit better off now because we know the markets are up a little bit, but they have to apportion their churches, because they're only about 50% funded right now, and they owe a lot of money. They have to apportion their churches over $4 million for the pre-82 funding that 2/3 of the other conferences are already fully funded. So it's an issue related to the strength and the financial viability of conferences right now, because we're not equal when it comes to benefits, and that's a huge obligation that some of the the conferences are carrying. So I pat you guys on the back. You would know in this conference that we have actually worked with the North Georgia Conference to swap money out. This is all, we can't get the money, the pre-82 money, until the whole program is fully funded, and then we would have to sell it to an insurance company for us to get our excess funding out. The only way that we can get the excess funding out is if the excess money is used to pay the same benefit in another conference. So that's what we have done in this conference. The annual conference approved this, that we would take the overfunding, use it to pay the North Georgia Conference's pre-82, and then they give us cash in return. And so we now, we're up to about 2.2 million now that we have in this conference that provides the funding for our operations, for the benefits operations in this conference. Because we've taken most of the overfunding out, we're building a reserve. So if we have a downturn, and your obligation is pretty small anyway because you don't have that many pastors pre-82, it doesn't take a lot of money. We're pretty close to meeting the maximum, what the worst case scenario. So we're really in good shape here. Any questions? I think I've got about 10 slides related to this, and I just did them all at once.
Bruce, I just wanted folks to understand that pension reserve trust that we have is going, the interest of that 2.2 million is paying his salary and paying for incentives for our clergy health prevention step challenges, as well as some of our mission congregations.
Right.
Is there anything else I'm leaving out? So that's the expenses of the annual conference that's not going to apportion to churches. So I just want you to celebrate that, take that message back, and give kudos to Bruce for his leadership in this.
I think it's important also to say that that's not being done at the expense of retirees in the pre-82 plan who are receiving their benefits as promised.
That's correct. In this case, we've increased their pension by 3% each year, and you're very generous in this conference. Not many of the conferences provide 100% to the surviving spouse. Most other conferences like PNW only provide 70% to the surviving spouse. So it's great that we've been able to do this. I think our budget in our pension budget's over $100,000, and it's all coming out of the endowments. And there's nothing, as Dave said, there's nothing in the budgets related to this. It was interesting when I first started this job and there was no money. How are we going to make this work? But we pulled some strings, and it's worked out pretty well, to say the least. This just kind of gives you an idea of the liabilities that are sitting out there and how many people are in each one of the programs. And you can see that we're a legacy denomination, that we have way more retirees than we do of active people sitting out there. So, and the annual conferences are responsible for funding these benefits, even though they are weird. I mean, there's huge inequities. This is just saying there was a huge concern, reason why the General Conference approved going into a new retirement plan about paying for this liability that we're accruing, and then the local churches being able to pay for it. Now the reason this is crossed off here, the Alaska Conference is a missionary conference, does not have to pay the defined benefit part of the current plan. And that saves about $6,000 a year per pastor that you don't see up here. And so that is not a consideration. What happens is...
But we still get it when we retire.
Yes.
Yes.
Who funds it?
All the other annual conferences. So you can thank the other annual conferences. You all retain, most of you, unless you're a part-time or full-time local pastor, you retain membership in another annual conference.
And when we do benefits projections on the website, that's figured in?
Yes.
Okay.
Right. It is. Yeah, it's not taken away. Your churches just don't have to pay for it. So you can see, this is with adding nobody to the projections. This is as of a date and time, and this is over $1 billion. It doesn't say dollar-wise, but it's a huge liability that we have to make sure that we're going to fund. We talked about all of these different things. We'll just move along. We talked about that your conference picked the 12% of the DAC. One of the things that's interesting that's happening right now is that General Conference said, well, to lessen the liability somewhat for the ministerial pension plan, these account balances that have grown, that are in people's accounts, starting next year, you can only annuitize 65% of that account balance. And we thought that maybe that would cause a bunch of people to retire this year, but when they see that they're only getting 3.5%, that's not the greatest option. Even though in P&W we now have 20 retirees this year. But I think that that's because we're at the leading edge of the baby boomers, and we're going to continue to see a lot of retirements for the next 5 or 6 years. So 35%, it doesn't go away. What happens is it gets rolled into your personal retirement account, and then you bear the risk of how you're going to get that to return something to you. The General Board of Pensions has put together a new program for those people that would allow them to put the money in and to kind of get a safe withdrawal rate over their lifetime. Because the General Board, one of the facts that the General Board of Pensions is facing right now is it's never good to have more money going out than coming in. And that's what's happening right now, is that there's more money going out because there's more retirees than there are actives. And then when this occurs, and if pastors start rolling their money outside of the United Methodist Church, that could become a real drag. And the reason it's important to us, especially that we invest with the General Board, is the more money they have under management, the less it's going to cost us. You know, expense ratios are important at that point in time. And so they're working aggressively to keep the money in. Plus what they've done, they started last year a program called WestPath. And WestPath is the investment arm of the General Board of Pensions, and they have been marketing strongly to United Methodist institutions. And they actually, I think, brought in about $500 million in last year. And so they've been they've offset that by getting money under management.
So that remaining 35% could be annuitized, but just not with the board.
That's correct. They could take it to an insurance company. That is correct. One of the things that we know from a financial planning standpoint, you don't want to be too overly annuitized. Because you have to remember, everybody, unless you opted out of Social Security, and unfortunately we've had a lot of clergy that opted out of Social Security, and that's a whole other story. But you've got Social Securities or annuities, if you're married, both of you, and then if you have your pension, those are annuities. And if your spouse has a pension, then you can end up, you have too much annuities, and you really need the flexibility of the cash that you have from the program. So we talked about this and here that you don't have any liability at this point in time. And you've heard this about, right now, defined benefit plans are going away. In fact, I was reading an article on the plane yesterday. Only 3% of people that are active people now have a defined benefit plan. I mean, that's a pretty amazing statistic. Also, you need to know that 50% of our people in the U.S. have no retirement plan. I mean, that's a huge issue. What are they going to do when they get towards retirement and they haven't put any money away? And the idea is that a defined benefit is exactly what it says. You get a monthly amount of money each month. You don't have to worry about investing it. And so it's security. And I can tell you from working with clergy all these years that they not necessarily the greatest when it comes to numbers and investments. Some of them are, some of them aren't. But I don't think their life's goal was to make a lot of money in the stock market or lose a lot of money. And so expecting them to take their own investments, retire, and then use it to get the appropriate amount of money out of it is going to be a skill set that they probably don't have, and they'll need to have assistance. Choice and flexibility. Yeah, you can do your investments, you can use it as your emergency fund. It's also, if you die when you're gone, well, we all die at some point, but this money that's left over will go to your beneficiaries. Whatever is put in your annuity goes to the conference to pay your benefits, so you can't access that money. Okay. These are the changes. This is the new pension plan. It's what I call CRISP, stands for Clergy Retirement Security Plan. I call the new plan CRISP Light because it's basically the same plan, but they've taken away, they've lowered the benefit. They've lowered the benefit, which means they've lowered the cost. In the Pacific Northwest Conference, the actual cost for the defined benefit plan is dropping by about 25%. So the churches will pay 25% less on that. Well, you don't have that because you don't have to pay that. But it's gone from 1.25 to 1%. So that means you've taken a 25% hit on your benefit. And this is only for years starting in 2014. Anything that you've accumulated in the previous years is not impacted. This is the hardest part in explaining a matching program. Before, and right now, your churches, and this is the only thing that your churches pay right now, is 3% of your plan participant compensation goes into your account, and you manage it however you feel, however you want to invest it. Or if you don't want to do that, you do what's called life stage, which is what most of our clergy do. Now, under the new plan, it's saying that the churches will pay in 2% automatically, but you have to contribute at least 1% yourself for the church to pay the other 1%. So it's starting the concept to try to get our clergy to contribute to their own retirement because the benefit is not as good. And we know that it doesn't matter what the stock market does in 1982 or the return on the stock market, this is an actual benefit that will not have anything to do with what the overall stock market is doing. So everybody, there is equality here. Again, it's of the denominational average compensation. It's not of your own compensation.
You say that change again about direct defined contribution in the percentage breakdown between the church and us?
This part right here?
Yeah, the church will be paying 2%
Right.
if we pay 1%.
Well, we're going to talk about that in a second. Just hold that a little bit. Now, this is kind of an interesting, this is an interesting change right here. Normally, most retirement programs, the actuaries figure out how much, whatever the formula is, or whatever you want to use, that if there's two of you, there's the pastor and the spouse, that normally you would get a less amount of money because the actuaries figure out over your lifetime how much you're going to pay out than a single pastor. That's not how the church worked. Let me give you an example. Let's say that two pastors, one is single, one is married. They both serve exactly the same through their whole career. Make the same amount of money, have the same service record. When they come to retirement, let's say that they're their retirement is $10,000. The single person is $10,000. How much do you think the married pastor's pension should be? Or is under our old system?
10,000.
10,000, that's right. So most of our clergy, and they still are males, and males have a less life expectancy than females. The male dies off. 70% goes to the surviving spouse. You've ended up paying more to a family, I mean a married couple, than you do a single pastor. And so under the new system, and this is only starting in 2014, not prior, it's going to be actuarially equivalent. So if you looked at two pastors that serve the same amount of time, one's married and one's not married, the married person would get a lower beginning benefit. They've gotten rid of the spousal difference.
It's been really nice, thanks.
And the reason they said is, well, way back when, the spouse was the team. You were a team. That you were a team. You did your thing as a team, and that's not necessarily the case anymore.
I wonder if there'll be a spike in divorces and cohabitation.
I'm still married for money.
It's gonna wait 2 years to
It's gonna wait 2 years.
Okay, let's try to explain the matching concept here. This is our current system. Under the new system, starting, there will be a match of 2%. That means if you as a clergy person don't do anything and you're not in UMPIP, that all that's going to go into your account is this, the 2%. The other 1% is what we call free money. You will not get it. So, and anything that's paid by the local church goes into your crisp defined contribution account. So if you ever go on to Benefits Access and you look to see, you will see an account called crisp DC. Any money that you put in goes into your United Methodist Personal Investment Plan. Now, one of the things that we're going to do in this conference is, for simplicity's sake, and to get all of the pastors to sign up, is we're going to bill the church 3% anyway. So, if a pastor decides that they're not going to do the 1%, guess what happens? Thank you very much. The conference board of pensions here gets the 1%. We don't want that to happen, so the DS is going to be working very closely with all the pastors, because one of the advantages we have in this conference is we're what's called a plan sponsor. There's only 5 of us in the denomination, 5 conferences, and I have 2 of the 5, where we actually do the billings and do the contributions. We do the whole thing here, and it gets billed directly to the church with the rest of the billing. Every other annual conference, the General Board of Pensions bills the local church directly. So I know who's doing what, and I'm going to give a list to the DS about who isn't contributing. And you're going to see in a slide in a little while, we're in pretty poor shape here in Alaska. Not many pastors are contributing to their own retirement. Did that answer your question?
Yeah,
So it's
so
really
we
a
contribute
maximum-
anything to UMPIP, 1% or more.
That's correct. This isn't new money. This is if you're already contributing at least 1%, you don't have to contribute anything more to get the match. Craig?
So it's really a 4% possibility?
That's correct, right.
But not 4% goes into crispy DC.
That's
1% of
correct.
it's going to go into
That-
UMPIP.
That's
Correct.
correct. These 2 accounts actually are the same thing in the sense. They have to be
Yes.
separated out for tax purposes, but you can manage both accounts if you want to. Okay. This is where we're going to get into talking about the decision that has to be made at your annual conference this year. Under the current plan, all part-time local pastors were eligible for the same plan. You mean the defined benefit plan. The General Board of Pensions brought the legislation to General Conference saying that they would continue to be eligible for, it would be required that they be part of the defined benefit plan, but a petition got approved at General Conference that allows each annual conference to decide what they want to do related to part-time appointments. So it's up to each annual conference to decide how they want to handle it, because it again gets down to the liability. So each annual conference will decide what the legislation did, though, is say that a quarter-time pastors cannot participate in the defined benefit plan. That is not an option. So that is one major change. So the decision here is pretty simple for Alaska, not so simple in PNW. Because you don't pay anything for the defined benefit, if you went to a defined contribution plan for the part-timers, what do you think is going to happen? You're going to pay a lot more. You're going to pay whatever the percentage that you decide times their planned compensation, which is going to be a lot more than what the free benefit is for the defined benefit. So you really don't have much of a, you can vote a defined contribution plan, but that would be illogical. So,
May I ask a question?
you can ask whatever you want.
Thank you. So if I were to retire before 2014, I'm not affected by that news?
That's correct. Right, and it's only service.
David?
Are we gonna need to talk, Julie?
It's only the service from 2014 on that's impacted. Anything else that you've accumulated before then is vested and it's not impacted. The only thing that's impacted is that in MPP you can only annuitize 65% of your account balance. That's really the only thing that's been impacted.
So if Julie gets up and leaves now, we know something about what she's decided.
Here's a handout.
I'll put that out there.
No.
Bruce, let me ask a follow-up question then, because a pastor, appointed pastor, active, can retire and still stay in the same appointment as a retired pastor.
Yeah, but
That
then
was
all
the other
benefits,
question.
there's no charges for benefits.
No charges for benefits. Right.
Repeat that, Dave.
Go ahead, Bruce, you do it.
Well, because of the shortage of clergy, and I can tell you this from PNW, we've got 20 retirements this year. We have a number of pastors that are retired that are taking appointments. Once they retire and they start receiving their benefits, there is no charge to the local church for the retirement benefits. It goes away. A church could, and I haven't seen any church that's willing to do this, they could enroll them as a lay employee, which would allow them to put money into their UMPIP, but that's a highly unlikely scenario.
Seems unethical
Yeah,
to put a clergy
That's
person in a
true.
lay category.
that's true. It is, though, we do have a rule in the conference that says that if you're a full-time pastor and you're making minimum salary, your church will be charged for the health insurance costs.
Right.
So just keep that in mind. If you do, I don't think you're planning on doing that up here, but we've got 3 or 4 of those down in PNW this year, so it's interesting. Okay, this one we have to make a decision. So this has been approved by your leadership team. That 3/4 and 1/2 time appointments. And it is interesting, you need to read this down here. A part-time local pastor can waive out of this benefit. They don't have to take this benefit if they don't want to. I know if you have anybody here, I'd have to look if you do or not. But if they want to waive out, after 2014, I've got to get a hold of them, they got to sign another form and everything. And many of the part-time local pastors, this is second or third or fourth careers, and they're already getting retirement benefits, and so they decided they don't.
Or not.
Or not. So, this one, I think is pretty clear cut. There really isn't much of a decision. You can come in, Dan, if you want to come in. You got room, you can sit right up here.
I like the escape seat right there.
So the major decision that we have to decide at annual conference today or tomorrow is what do we do with the quarter time appointments? And the leadership team is recommending to annual conference that we do, and you have to remember, this is a quarter time appointment, and I would guess out in the secular world that hardly nobody would get a retirement benefit if they worked quarter time. This is just saying, in this case, the churches that are, the pastors that are in the plan right now are paying 3%, because remember, they aren't paying the defined benefit. This is just saying 3% and maybe a 3% match. It's a voluntary thing. And we didn't, as a leadership team, want to say, well, you got to do a 3% match, because that end up, if that church couldn't afford it, that this is additional money than they're currently paying. So I don't know quite how I'm going to administer this, or in what forms I got to fill out with the General Board of Pensions, but it's the idea. We hope that the churches are willing to provide the extra 3%, but that means that the pastor has to contribute the 3%, and pastors that work at quarter time are probably the least likely to have the money to do that. So,
Bruce, who has authority to determine the percentage of an appointment? Is that the superintendent and bishop?
yep, that's correct. Usually it's related to the
How much
minimum
money is there?
compensation.
Yeah.
So, right, it's interesting, the discipline doesn't define. And so when we went to the new CRISP plan, each annual conference kind of had to figure out what a quarter time, half time, 3/4 time means. And in most conferences, they said it was a percentage of the minimum compensation. Now, we all know that if you work in a quarter or half time, you probably work a lot more than that, but that's why it's related to the compensation. Yeah.
Bruce, when you're talking percentage, if it's a quarter time appointment and with a quarter time salary, 3% of that is very small.
That's true.
So your comment that they might not be able to afford to pay it, seems like it's gonna be small enough that it's commensurate to their salary, so they might be able to afford to pay
Right.
it. Even the church might
Right.
be able to afford to pay
And
it.
that's why it's saying, we're not forcing, we're not saying it's mandatory.
Yeah.
It's hopeful that church will agree to do the extra 3%. Lonnie?
There's a subtlety in Dave's question and your answer to it that probably needs a little explanation. If you'll remember, at General Conference, a petition carried on a consent calendar to do away with guarantee appointment. The Judicial Council reversed that decision. However, there was a portion of the legislation that was not reversed, and that was to empower the bishop and the superintendent, or actually the bishop with consultation of the superintendent, to appoint an elder to part-time service involuntarily. And that's a factor here. And there has been no test yet of whether that will stand review by the Judicial Council, but that's what the law is right now.
Good insight. Okay, moving on. Any questions about the retirement plan? We got 35 minutes to get through the rest
Just
of
a
this.
real quick question. What percentage of our churches are less than full-time at this point?
A lot.
The appointment sheet, when you get it tomorrow, will have all that on there.
Quite a few.
Yeah.
Okay, pretty
5%.
pretty simple explanation. The benefit, retirement benefit's going to be less. You probably all know about the three-legged stool of retirement planning. Social Security, your pension from retirement, if you have one, which a lot of people don't anymore, and then your own money that you have invested, either taxable or through a tax-deferred approach. This is just saying that we've got to get our pastors on board to start contributing to their retirement, because they're not doing a very good job of it, and we're not going to have any of these miracle returns that we've had in the pre-82 and the MPP. Don't have to worry, don't have too many clergy that are 50 and older that are putting $23,000 into their account. That's how much you can put in. This is a 403B plan. So the limits, you don't have to worry about getting to the limits. Most of our clergy are not going to get there.
And that doesn't matter if you're full-time or part-time?
That's correct.
Okay.
I'm going to change the pastoral support worksheet, so that's a line on the pastoral support worksheet. And the DS is going to know who isn't contributing, and I'm going to give them a form to take to that meeting, and hopefully they will sign up. No pressure. Again, this is free money, and at a minimum salary, I think we figured out it's about $40 a month. So many of you would say, well, I don't have $40 a month, but I bet you if I sat down and worked with you, we would figure out where you could come up with $40 a month. So what can you do? How can you do? What can you do to help you out? The General Board of Pensions offers free service, free financial planning service through Ernst & Young. It doesn't cost you anything so long as you have an account with the General Board of Pensions. Ernst & Young is a very large consulting firm, and they have certified financial planners that are there to help you.
Very helpful, by the way. How many of you have used them?
They're excellent.
They are.
I mean,
And then
excellent.
I just threw in, and these are some of the things that they can do, and I just threw this other thing in there. This is me, by the way. I am a certified financial planner, and I'd be glad to help you in working through some of these issues. In fact, down in the Pacific Northwest Conference, they actually contract, and I work closely with a lot of our clergy.
So Revelation, that brings up to mind apocalyptic images.
That's true. If you're not with the plan, you're going to go over the plan.
If he sends out letters to 7 churches, watch out.
Yeah.
Planning with the end in mind.
Yeah. Ooh.
Okay, we got about 35 minutes to talk about healthcare reform. This is a major moving target. Regulations are being written. About every few weeks I get a long epistle from the legal person at the General Board of Pensions that's on top of this about all the things that are going on. Unfortunately, it's written in legalese, and I don't necessarily understand all of the ramifications. But let's see if we can get through this. You'll get an idea about how complicated this is and the potential of how it might benefit the local churches. But we got to figure out and wait until we have a little better idea how it's going to work. So we all know the Supreme Court upheld the individual mandate, so that means everybody needs to have health insurance or they're going to get a penalty on their tax return. In fact, the penalty is pretty minor, but it is a penalty that's there. This is the biggest change, and starting in 2014, there will be these health insurance exchanges, and in the case of Alaska, it will be the federal exchange. And this is where, and 2 of you have come through, but I sent out an email asking for your adjusted gross income and your exemptions, and you're going to see why this is incredibly important that we have this information, because this premium tax credit is dependent on, the eligibility is dependent on what your tax returns say. And you'll see here in a minute how that's going to work. We don't have to worry about employers' shared responsibility because it only applies if you have 50 or more employees. And that's not employees, that's full-time equivalent employees. And I don't think we have a church in Alaska that has 50 or more employees. So we don't have to worry about that. Expanded Medicaid, that was one of the things the Supreme Court threw out and said each church would decide what they want to do with it. If a state has decided that they want to expand Medicaid, and fortunately Alaska has decided not to do that at this point in time, you'll see if you don't expand it, then it's anybody that's will be eligible for Medicaid if their income is below 100% of the federal poverty level. The expansion means that this number rises from 100% to 138%. It'll make more sense. This probably doesn't mean anything to you right at the moment, but you'll understand by the time we get finished if, what the federal poverty level, what that all means here in a minute. This is the current state map as of a couple days ago, and you can see that Alaska, well, you can't see it at the moment, but I think it's on, in fact,
It's there, it's at the
By
bottom.
Hawaii,
It's down by Hawaii.
where is it? I can't even see
below
it.
California.
Below Texas.
Lower left.
No, I was trying to see, I think the other part of the slide is saying what each one of these colors
right at
mean.
the top.
Oh,
I'm missing the
It was at the
symbol.
top.
It was right at the top.
Oh, it's at the top.
Yeah.
Right
Right
there.
there.
Oh, that's right, that's okay. I feel better. I changed the slide from what I did in PNW. Will not expand, that's Alaska. So it's interesting, I've got a variety in my conferences trying to interpret all this stuff. So that means the Medicaid will be 100% or less for Alaska. Okay, the exchanges is very similar to financial exchanges, however you want to look at it. It's just a marketplace where the insurance companies will come and then the individual will pick and choose amongst different plans. And that's basically all the exchanges are going to do. And they all have to follow the rules and regulations about what is provided. One of the interesting things is, and I went to a presentation here late last year from a person from the Insurance Commissioner's Office of the state of Washington, and she said, one of the reasons it's important that we have these basic plans that everybody has rather than people having some insurances is that they will have a plan that will cover their health if they have a catastrophic problem. People were buying policies, they were looking at premiums, and they were buying policies that like capped their insurance coverage at a $50,000 or $100,000, and then they had a catastrophic claim. And they said most of the people that were in bankruptcy right now were not because they didn't have health insurance, it's because they thought they had adequate health insurance and they didn't. And so one of the things that under the exchange programs, that all of the plans, even if it's the cheapest plan, will have an out-of-pocket maximum and everybody will be on the same playing field. This is where, and this is how we got to work the system here. They provided us a process, and we got to figure out how to make it work within the United Methodist Church. And there's going to be two things that are going to come into play here. If your income is too high, you're not going to get a premium tax credit, and if your income is too low, you'll go to Medicaid, where the premiums are nothing. So we've got to figure out, and that's why it's so important that I know where we are in our conference and see if it makes sense to proceed or not to proceed to get the premium tax credit. Because you're going to see in a minute why many of our clergy are going to qualify for this. We talked about that. Now, this is where we got a problem. You gotta have two things you gotta meet. Many of us will meet the first one.
What is the FPL? I mean,
We'll see that. You'll see it in the slide here in a minute. If you want to look ahead, you probably can't read the writing, it's too small, but you'll see what it is here in a minute. Where we do not qualify at all is the plan has to be unaffordable. Well, how much do you pay? How much do you pay in your health insurance here in this conference?
Nothing.
Nothing. So guess what?
Arguably $150.
So we could have many that qualify here and we have nobody that qualifies here. So if we want to make this work up here, and there's large dollars to be saved, and so we're trying to put something together to make it work. We got to figure out how to make it unaffordable. So what does unaffordable mean? We'll see that in a minute. Okay. Modified adjusted gross income. For you that are tax people, don't confuse this with modified adjusted gross income that has to do with income taxes. This is a specific definition for healthcare reform and the premium tax credit. So, and I'm sure that almost every clergy here, your modified adjusted gross income is going to be your adjusted gross income because you don't have these items. If you do, you're unusual. So, for all of you clergy, I sent you out, I'll cross out whose name this is, an email, and what we're looking for is how many exemptions you have, and then what line 37. Line 37 is your adjusted gross income on your Form 1040, and what that number says for your 2012 tax return. Then we'll have an idea of how many people would qualify for the premium tax credit and then figure out how to make it unaffordable. So without knowing that information, the General Board of Pensions has made a guess, but I can tell you that guess, they know what you as clergy make. What they don't know is what your spouses make or don't make. And so that's the part that's sort of the mystery that we'd like to solve.
And how did we clergy in Alaska do in returning that form to you?
Not too good.
two.
Well, this is the second try.
You
I'm
asked
going
that
at.
they be brought today.
Yes, and I'm collecting them. So, no, the first time.
Do you need it the second time if we sent it the first time?
Well, that's 2011, so if you want to give us an updated one. We did have about a 40% response, which the actuary says to get a viable, acceptable response, we need at least 75%. So we've got a ways to go. Okay, why would a lot of our clergy qualify for this?
Because of the housing.
Because of housing, absolutely. Housing is not included in adjusted gross income. So if you live in a parsonage, that's not included, or if you get a housing allowance, that is not included. Down at the Pacific Northwest Conference, 67% of our clergy fall within 100 to 400%. That's a pretty big number. I would guess that the numbers are probably maybe not that high, but they're probably at least half of our clergy will qualify for these premium tax credits. Now you're probably saying, well, what's the big deal? Well, you'll see what the big deal. Remember, the premium tax credit is supposed to help people that don't have insurance or they're lower income, and they give you big dollars. I mean, we're talking a lot of money here to help you buy health insurance. Okay. Got to look right here. Alaska gets an exception. Alaska and Hawaii are different than all the rest of the states. These numbers are the numbers for the 48 contiguous states. You just have to take 25% and add them to this number, and this is what you'll get for Alaska. So if you look at these numbers, a family of 4, they're pretty large numbers.
Does it go higher than 4?
Well, yeah, I could, but I'd be over here. My slide isn't big enough. So you just know that that would be even a bigger number here. So when you take the housing out, a lot of our clergy are going to qualify from an unaffordable standpoint. Or not an unaffordable, from the income standpoint. And just remember to take 25% onto these, add that on. Okay, this is actually what the General Board of Pensions, from their estimates, using Mercer, the actuaries, how many they believe will fit into the categories. I got 85% of our clergy in P&W to respond, which I can tell you right up front, no annual conference benefits officer other than me would ever ask a pastor for their adjusted gross income. That's not going to happen. But I'm not beyond that. You have to know that. And so I got 85% of our clergy to respond down in P&W. And you can see over here, the numbers are significantly different than what the General Board of Pensions estimated they would be. So in PNW's standpoint, as I said, we got a 64% of our people either would be below the federal poverty level 4 times or be on Medicaid. Now I'm just going to throw in a monkey wrench to this whole thing here. The General Board of Pensions, and the reason this line is right here, I added this from P&W. In the last couple of weeks, the General Board of Pensions, they want to keep their current, you have to figure that if people go to the exchanges, they're going away from the current plan that we're in with the General Board of Pensions. And that's going to lower the number of people in the plan, and you know, the less number of people, the negative impact that it has overall in the program. So the General Board of Pensions sent out didn't send out an email. I was on a conference call and I didn't realize what they were saying until after I got off the conference call. There's something that we have now that's called mandatory funding. You're probably very familiar with that. If you're a full-time pastor, your church will be charged. And it doesn't matter if you're in the plan or not in the plan. That's what the mandatory funding rules are. And the reason it's there is that we got into all kinds of trouble about 10 years ago when it was not a mandatory program. It was voluntary, and the healthy and young left, and left the old and the sick, which is about what we have. No, I won't say that. So they said it's mandatory. So the rules that they are proposing, and hopefully I'm going to get them to change, is they're saying that the mandatory would, anybody that's from 250% above, they're going to still bill us for even if they left the plan. And so that took out a huge amount, and so I'm trying to get them to at least move it down to 300%. So what we're really, from saying all that, even though the federal rules say at this point in time that if you're 400% or less, that you're going to qualify potentially for the premium tax credit, I think reality from the way our plan works is that we're really looking at 300% or less, which will still provide a significant number of people. And one of the other reasons is, and the actuary said this early on, is the plan, if the federal plan sticks at the 400% level, is going to end up way more expensive than that they've ever calculated it to be, and they will probably move it up. It's just going to be too much money for taxpayers and everybody else. So lots of moving parts. Again, try to get me this information. Many of you have, but I still don't have a credible number, and this is where it is. That's what it looks like. And if you need a copy of that, I can gladly provide it to you. Again, we just need the number on 6D and the line 37, and make sure you put your name. If you send it to me without a name, that's not going to do me a whole lot of good.
He needs to rank people according to their
That's true.
adjusted income.
I do.
So what's your prognostication? Come January 1st of next year, will we all still be covered under health flex in our church's bill?
Oh, yeah, absolutely. If we weren't, I would have a proposal to you here at annual conference this year, because this is a big enough change that we need annual conference to approve. And there's too many moving parts right now, and all the rules haven't been written. And so, at this point in time, everything will stay the same next year. But it could be, if we have it figured out, that we could have a proposal coming next year. Now, if I was in your shoes, the last thing I would want to do is to go into a brand-new plan. The federal government's going to be running it here, that I wouldn't want to be part of that. I want to have the bugs get worked out, because there will be a lot of bugs initially, just getting it started. And as a benefits officer, the last thing I want to do is put you in a plan and then it doesn't work, and then you're calling me up saying, why did you do this to me? So we will not be doing the exchanges next year. But it is something, if we can make it work, that we'll look seriously at. So this is the part that we got to try to make it work. The law says that to be unaffordable, I mean, I don't know where they come up with these numbers, but somehow they come up with it, if it exceeds 9.5% of your household income, which in this case is the modified adjusted gross income, which in most cases is your adjusted gross income, it has to be above 9.5% of that. So just thinking in your head, you know what the health insurance premium is. We got to figure out, the only way that we can make this work is we got to charge you for the cost. But there's a way to get around this, is that we raise your compensation. This is kind of a way to make it work, is to raise your compensation such that we don't drive so many people too high. Because when we raise compensation, it's going to raise your modified adjusted gross income. We've got to kind of balance how to raise your compensation and then charge you for it. That's a pretty good deal, right? It doesn't really cost you anything. It doesn't cost your church anything, other than the church will have to pay a little bit more in the defined contribution and the pension side and the disability, but that's a pretty minor thing. So that's really about the only way to make this work, is that you have to pay something. If you don't pay anything, you're not going to qualify. And in the case of your conference, the churches pay the whole thing for the family. So it doesn't make any difference. And it's kind of an issue down in PNW, because in PNW we only make the church pay for the pastor. And the unaffordable part of it only has to do with the cost to the pastor. Pastor doesn't count related to the spouse or children. So the 9.5% is only of the pastor's share.
Is that there isn't $150 per family that the...
That's true, there is.
Yeah.
But that's not going to, and the family doesn't count, remember. It's only what the pastor pays, and in Alaska, the pastor doesn't pay anything.
Okay. All
Right, but you are correct,
Okay.
$150.
Yeah.
So it's only the pastor's premium.
Yeah, that's correct.
So you gotta figure out what that is out of the combined premium.
Yeah, I know what that
Okay.
is. The
And
income's
then
billed
it's got
us.
the pastor's gotta figure out how much of the, because that's the number on, that's the, what do you call it, MAGI? That's a
Modified-
combined family income.
That's correct, it's the family income.
So it comes off, it's 9.5% of the family income, even though it's only for the one person.
That's correct.
Okay.
That rule only about the pastor only came out a few months ago. Yes.
I'm under another health plan, not this one. So will that, I was my church and I still have to go through this one.
No, I mean, you're not part of our program, you can do what you want. I mean, what you'll quickly figure out is, though, this plan goes into effect for the country starting in 2014. Our annual conference is not going to do anything.
Okay. The other question is, if, say, something happened to my plan, if say I were to retire, can I go on it in retirement?
Well, you're gonna figure out, if your brain is thinking here, when you see, you will know what your modified adjusted gross income, and when you see what the premium tax credits are, and you see that, gee, my plan maybe with premium tax credits only cost me $200 a month, and I'm currently paying $700 or $800 a month, it might say to you, well, I'm gonna move to the exchanges right now. And there's nothing to keep a part-time, and this applies for lay employees of your church. If you don't offer a plan to your lay people, this could be the plan. You're not offering it to them, but it's a plan, and you're gonna see here in a minute that you gotta let them know about this program.
Isn't it likely that even without the premium tax credit, that the exchange annual cost will be less than HealthFlex?
The answer to that is no.
Okay.
You will see in the estimate of the premiums that the cost actually for a family is like $1,950, which is not less than our plan.
Monthly.
Monthly, that's correct. The insurance companies are going to charge what is the appropriate amount to provide the coverage. It's the premium tax credit that makes the cost to the participant dramatically lower. But I mean, so if you individually, if you're 400% or more and you don't qualify, it wouldn't make any sense to you to go to a plan that's going to cost you about the same. The other reason it wouldn't make any sense to you is if you stay in the plan and you have to pay anything, you get a salary reduction for that. Whatever premium you pay on the exchanges, you don't get a tax benefit. And one of the annual conferences, and this is pretty interesting, early in the game, they were saying, before the rules had been written, they were saying, well, why do we even want to have a conference health insurance plan? What we can do is we can send everybody to the exchanges, and what we would do then is we would give them money in what's called a health reimbursement account. You know that as active people what a health reimbursement account is. We'll just give them money to pay for the premium. And they actually had the legislation all written coming to annual conference this year. Guess what happened? The feds wrote the rules saying that if people in the exchanges cannot have a health reimbursement account. So their whole game plan just went up in smoke. So they have to now figure out how to make it work within the unaffordable rules here. So let's proceed on here. This is where we are with the exchanges. You all know this, that you're going to get a federal exchange. And the thing that I find really quite amazing is, and you can see this is a lot having to do with the blue and red, the political spectrum. If I wanted to control a little bit about my program, do you think you would want the feds coming in and doing it? I don't get it. I really don't understand. Because that's what's happening here. The feds are going to do the program here in Alaska, even though you didn't want to have anything to do with it up here. But now you get the whole thing. At least in Washington, they've been working on it for a couple of years, and they get to have at least hands-on a little, it's being handled there locally, even though all the exchanges have to provide the same benefit. Got to be handled the same way. Kind of going back to sort of about your question, the costs in the exchanges actually will be a little bit less than what is in the overall insurance market because they're compressing. Right now, the age 3-to-1 ratio is about 6 or 7 to 1. So if you're age 64 and you went out to buy a health insurance plan, it would be way more expensive than it will be in the exchanges. even though our plan is pretty interesting. You think it's costly, but if you went out to get a quote and you're in your late 50s or early 60s, I think you would be surprised about how costly it is. And one of the advantages is our premiums have not gone up as much as being a group fully, ours is a self-insured plan, and so our costs are related to our experience. And then all the plans have to cover the same thing, no matter if they're in a federal exchange or a state exchange. And they all have the out-of-pocket maximums. And it's interesting, I asked the actuary, and these are the 4 different plans that are going to be available on the exchanges. And our plan that we currently have is somewhere about right here. And you can see that all the out-of-pocket maximums are the same on each one of the plans. It just means your co-payments and stuff are going to be different in the higher level of payment. So this is really the important line to look at, the actuarial value. But if you go to the exchanges, you can decide which one you want. And the premium tax credit actually is only paid on this, they look at this plan. Yeah.
How are they dealing with pre-existing conditions?
They go away. That's one of the things that healthcare reform, and you probably remember for children, it went away a couple of years ago. Starting in 2014, the pre-existing conditions go away for everybody, and this is interesting, everybody that's not on Medicare. Pre-existing conditions still exist for anybody that's in Medicare. But if you're under Medicare age, which is 65, then there are no pre-existing conditions under the exchanges. So that's a good deal. Let's see. That's not relevant. Well, it's interesting though. What will happen if somebody does qualify for the exchanges and they do have coverage or potential coverage for their employers? They're going to be contacting the employers to find out how much you're charging them. So that means that I'll probably get involved, that I'll get a wonderful letter from the IRS. Okay. This is what you really need to remember. These numbers, you have to add 25% for Alaska. And this is where the 1950 came from. These are the estimated, and our premium here is 700, so it's not that much different. A little over 700. So look at these numbers. I mean, if you qualified here, 250, and you have a family, and it costs you $410 a month, or their insurance company is going to charge you $1,910, that's $1,500 per month in a premium tax credit. That's big dollars. You want to figure out how can you get access to that and get access to helping the churches. Now, the concept would be if we can make this all work, and let's say we have half of our clergy go to the exchanges, we would raise their salary to make it unaffordable, but they would have more salary that they would then go to the exchanges to buy the cost. And then the people that are left in our current plan, any church that has a full-time pastor, we would spread it over all of the churches. But we'd only have half the number that are in the plan, let's say, so that could mean the cost to the local churches could go down by 1/2. I mean, that's kind of the concept. I did a flow chart on this one the other day trying to get all the parts together, and it does work. It's just going through the machinations, and we've got to figure out, I mean, the challenge is with the data that we'll get, what is the number that will cause the most people that become unaffordable?
So we've maintained the blended rate concept.
Yeah, right.
So we'd have to know who's appointed so we can compute what that blended rate is.
Yeah, that's correct.
Which is the
We
same
have
way we do
to-
now.
See, that's what we don't know, because it's all after the fact. We know what 2012 is, but, and you're gonna go on that, and if you have a major change where your spouse all of a sudden gets a job and they make $40,000 a year and drives you up above that, then we gotta figure out how to deal with those situations. And so,
So that's on a year-by-year basis whether you qualify or not?
that's correct.
Okay.
That's correct.
And so say half the, you use that example, half qualify. Is that going to, if the group then is half the size, is that going to also likely increase the cost of the premium for a group member?
Yeah, excellent question. The cost, the actuaries have already told us that at a minimum, if conferences start going to the exchanges, that we'll have a 10% increase in our rates automatically, nothing else related to claims. But I can tell you, 10% cost increase compared to the savings that we would get by having people in the exchanges, that's a willing bet to make at that point in time.
But then but that's still distributed over, the formula is going to distribute it
That's right.
over.
All
So
the
the
churches.
balance between the exchanges and who's left in the group,
That's correct.
it's still, the intention is that for the for the church, they're still gonna be paying the same thing, I mean, this equally as they are now. Is that
Well, it'd be
right?
lower. It'd be
Lower, but I mean,
equally
but
lower.
the same within the, if right now they're paying $1,900.
Right,
Everybody's paying $1,900.
that's correct.
And if they started paying whatever it is, $1,500 or $1,000, everybody's gonna pay the same.
That's right. I mean,
Okay.
the concept is if we don't have a system like that, it's gonna be a nightmare for the bishop and the DS to appoint people. If some are to the exchanges and some aren't in the exchanges, we've gotta have the ability to keep a level. I mean, this is a concept I have in my head at the moment. I don't know where it's gonna come out next year, but that's kind of the idea I see it right now.
Is there going to be an annual determination of eligibility, or will that be adjusted during the year?
Those are questions I don't have an answer to.
Okay, I didn't think there was an answer to
Yeah,
that.
well, under the healthcare reform, it's always gonna be a year behind. Because the tax return is looking at your previous years, and you'll see that there's a safe harbor. Safe harbor means that you qualified, but you really didn't qualify. That during that year, let's say you got a whole bunch more income, you're getting the premium tax credit, but what they do is they cap it at like $2,000, but maybe they gave you 20. Now, how that impacts, if you were in the exchanges one year and not in the exchanges and you're back in the conference plan, those are issues that the general board's got to help us sort out, yes.
Well, is this then gonna change, in theory, then, our current thing here in Alaska where churches will start dropping from being full-time to less than full-time so they can get out of the
Could
insurance
be.
thing?
I mean, that's nothing new.
No, I mean, is that gonna
You gotta
change in
work
the
with the
future?
GS and the bishop on that. But that could be, but one of the things we know is that once the populace understands the money to be saved on this, we've got to come up with a plan, because they're going to be asking us, why aren't our pastors in the exchanges? Well, your answer to that right now is pretty simple, because it's not unaffordable. The churches are paying the whole premium, and I don't qualify for it. Okay, this is, we actually have gone overtime. We'll do this quickly. This is just an example of how it might work. And in this case, the person is in the sweet spot. Turns out the sweet spot from looking at all the data is about half of the premium for the pastor. And that's about $350 a month, and the premium is around $700. So that's about where the most number of people that would qualify to be unaffordable, where we see right now where that number is. Dependent coverage, remember, this doesn't count. doesn't count towards the formula. 350 it is greater, so it is unaffordable for her. So she goes to the, in this case, you go up here, it would be the federal exchange, but same idea. This is the part that kind of blows your socks off. She's going to get a premium tax credit of $20,640.
Wow.
I mean, at this point, you're going to, wow, hey, you know, that there's money to be made, because this is what the estimated premium is for the silver plan, and then this is advanceable, probably didn't say this, on your tax return, you get it advanced to you. You don't have to wait for when you file your income taxes. They advance it to you. You use that money then to pay to the insurance company, which is going to bill you the $1,950. So your money and then the premium tax credit will be used to pay the cost. And this is just an example of what would happen, and this is where the crazy machinations come in. No longer qualifies, but you can see that they actually max that there's a safe harbor, that this